So, hi everyone, good evening, and welcome to our session for cancer awareness. About Dr. Neha Vora. Dr. Neha Vora is a highly experienced cancer health coach and advisor to several cancer focused startups, where she leads cutting edge interventions to improve cancer care across India and the APAC region. With a MSc in Global Healthcare Leadership from the University of Oxford and an extensive research background in cancer, Dr. Vora has devoted much of her career to advancing cancer care solutions. Uh, Giving the mic to Dr. Neha, please take it up.
Thank you so much. Good evening, everyone. Thank you, Anamika and IMT Care for having me. It's my pleasure to be here and go through this cancer awareness. Just like any other presentation, I will go through it first and then there'll be an opportunity to ask questions, etc. at the end. So I'm not going to go through my details. Anamika has introduced me, but I am a cancer health coach and advisor to other several cancer-based startups. That's just a little bit about me. But now moving on into the presentation, just tell me if the slides don't move. That's if there's any issues, then I would it would be nice if somebody can just.
No, it's okay. I'll guide you. No problem.
Okay, thank you so much. Thanks. Um, Cancer is probably not a new word for most of you here. Everybody's heard it. Unfortunately, if anybody in your family's had it or within your family and friends have suffered from it, then you're all very well aware of cancer as a disease. Cancer is, I'm just going to go through very briefly into some statistics. Cancer is one of the most common cancers among women in India, which is breast cancer. It accounts for about 27% of all cases, usually seen in the age group of 50 to 60 years old. But in India, we see it significantly rising within the younger age group of about 30 years old. The second most common cancer in India is cervical cancer, which accounts to about 23% of the cases. Again, 38 years is the average age we see over here. Among men, prostate cancer is steadily increasing in India. Most men above the age of 60, 65 are diagnosed with prostate cancer, though we are seeing younger men also being diagnosed. But usually the age we say is about 50. And lung cancer is another major cause of cancers within more in men than women, but it happens in both, where smoking is the primary cause of it. And again, this one is also seen in higher age groups of over 50 years and above. So these is just a national statistics of different kinds of cancers and the most common cancers that we see in India. In terms of detection highlights, in India, 63% of cancer deaths among Indian women could have been prevented if there was comprehensive cancer screening programs. That is very important to highlight, that the importance of early screening, which we will keep going through this presentation. In India, we have almost 60% of cases are not detected at an early stage, whereas only 30% are detected in India at an early stage, whereas abroad it's almost 60% of cases are detected at an early stage. And if detected early, there's an 89% chance of survival. So again, it very strongly highlights the importance of early detection. I'm not going to very strongly use the word prevention, but some of the cancers can be prevented, which we will talk about through the presentation. So coming to first very basic question, what is cancer? The word is very scary. If somebody tells you that they know somebody who has cancer or has cancer, then it's a very scary word. But cancer is an uncontrolled growth of abnormal cells in the body. And these abnormal cells, they form a mass of tissue, which is called a tumor. So there are two types of tumors. You have benign and malignant. So benign tumors are the ones that usually grow slowly and they don't grow into tissues around them. And they don't even spread to other body parts. They're usually very localized and they stay at one place. Malignant tumors, which most people understand as cancer, they grow quickly and they grow uncontrollably, and they are the ones that can spread to areas close by or other parts of the body. Moving on to, sorry. So just going to go very briefly into staging of cancer. Because people have heard that cancer is stage 1, 2, 3, 4. So I'm just going to give a very brief layman's overview of what is staging of cancer. So stage 1 means that cancer is very small and it is contained within that organ that it has started in. It's not spread anywhere. Stage 2, the cancer or the tumor is slightly bigger than the stage 1, but again, it hasn't spread to the surrounding tissues. Sometimes in stage 2, it means it may have gone to the lymph nodes nearby, which are close to the tumor, but it largely remains fairly localized. Stage 3 is that the cancer may have spread to the surrounding tissues and the lymph nodes nearby. And stage 4 means that it has spread to another part of the body from where it has started. So, for example, if we take breast cancer as an example, stage 1 means it is localized to just one part of the breast or just one area of the breast. Stage 2 is it might be slightly bigger in one part of the breast, but has gone to your axillary lymph nodes or lymph nodes that are under your armpits. Stage 3 is that it is localized within the breast to another part of the breast. And stage 4 is that the breast cancer has now also become an ovarian cancer. So your primary might be breast, but it is found in some other body part also. So this is what it means in terms of staging. We've just been through this, but just again to reiterate, one of the most common cancers in India, we have breast, lung, oral, cervical, stomach, and bowel in that order of incidence. Breast remains largely as the highest cancer with the maximum amount of incidence in India. I'm just going to very briefly go through the cancer risk factors. So people mostly believe that cancer is a genetic disease and that if it is in your family, then you are going to get it. But only 5 to 10% of cancers are genetic. Largely 90% it remains as a lifestyle disease. That's why there are modifiable and unmodifiable or non-modifiable risk factors. So the non-modifiable risk factors are gender. So for example, if you're talking about breast, if you're a woman, you will be at a risk of breast cancer. Age. So the risk of cancer increases with age. Of course, if you have a family history of any cancer or breast cancer, then it does increase your risk for it. And now they do a lot of genetic testing and genetic mutations from which you can know whether you have a risk of breast cancer or any cancer, which is mainly the BRCA1 and the BRCA2 gene. Now, the modifiable risk factors. So these are the risk factors that is a lifestyle part of it, which is mainly alcohol, smoking, leading a sedentary lifestyle, not being active, obesity, especially after menopause, hormone replacement therapy. People have been taking it for a very long period of time, any infections, etc. So these are all the modifiable factors that we can have a role to play, which we will talk about as we go through independent cancers later on in this presentation. So that is how there are these factors which help towards, we know these as risk factors. So modifying them or working on them can reduce your risk of any of the kind of cancers. Coming to general symptoms of cancer, these are very general. I repeat again, if you have any of these symptoms, it does not mean you have cancer. It just means that you need to get yourself, it's an alert system to get yourself checked or to get yourself spoken to a doctor, etc. Because these are very, very general symptoms for cancer. So one is weight loss or appetite loss. So when you are not actively trying to lose weight, but you keep losing weight, then that is something that you need to get yourself checked. Feeling fatigued or tired very often is another sign of cancer. Unusual bleeding, especially in women or even in men. If you have rectal bleeding, then that's not a normal thing to be happening. So you must go and get yourself checked. Coughing blood or pain while breathing, which is again one of the very important symptoms of lung cancer. So that can happen there. Unexplained lumps in the breast, which is of course a sign for breast cancer, and changes in bowel habits. So these are put together very general symptoms. And I'm again reiterating, if any of you have any of these symptoms, please don't panic. It is not a sign that you definitely have cancer. It just means that you need to get yourself checked. You need to get yourself assessed to see if there is any risk there, and further investigations may need to be carried out by your doctor. So I'm just going to go into the depth of certain cancers, and we're just going to go through the most common cancers. So first one will be breast cancer. As we all know, it's a type of cancer that forms in the breast. It is the most common cancer among women worldwide. They say 1 in 8 women will be diagnosed with breast cancer in their lifetime. Men can also develop breast cancer, though it is very rare. Only it's about less than 1% of the cases where we see men also having diagnosed with breast cancer. These are the 4 main types of breast cancer, but I'm not interested in going into the details of each of them. But these are what they are called, like ductal carcinoma, invasive ductal carcinoma, inflammatory breast cancer, and triple negative. So the triple negative breast cancer is the most aggressive form of breast cancer. So here are the signs and symptoms of breast cancer. Again, I would like to reiterate, having one or more of these signs does not mean that you definitely have breast cancer. You need to go to a doctor, you need to get it investigated, you need to get it checked out. So if you find a lump in your breast or in your underarm, that is one of the most important signs. You have breast pain. It's called dimpling, or your skin texture around the breast becomes more like, it's called dimpling, but it feels more like a peel of an orange, or it looks like an orange peel. Then that is something that is a symptom. Lump in the breast or armpit, as I've said. Any changes in the size, shape of your breast, and also any changes in your nipple, especially if the nipple is inverted or you have any discharge from your nipple, which shouldn't be there. So the only discharge, I mean, unless you're breastfeeding, there should be no discharge from the nipple. And there is redness or swelling around the breast. So these are the main signs and symptoms of breast cancer. And I'm reiterating again, please don't panic if you have any of them. Please just go and get it checked. Coming to the most common cancer among men, which is prostate cancer, it occurs usually in men above the age of 50 years. The statistics, it shows that it's the most common cancer among men worldwide. It is preventable if it is known early, because it's linked to risk factors again. So it's a very simple blood test called PSA, prostate specific antigen, that can be done and which can tell you your risk for prostate cancer. These are the types of prostate cancers. There is adenocarcinoma, transitional cell carcinoma, squamous cell carcinoma, and small cell prostate cancer. So these are just the different types, and that depends on the type of tumor, and that will be known only once a tumor biopsy is done. Signs and symptoms of prostate cancer: pain while urinating, an increased need or increased frequency in urination, slow stream while urinating. If you have any blood that is detected in your urine or your semen, you have pain in the back or in the pelvic region, and you feel weak in your legs or feet. So these are the most common symptoms of prostate cancer. Again, if you are in that age bracket of about 45, 50 years of age, and you're experiencing any of these, then please go and see your doctor and get yourself investigated. Now, cervical cancer. Now, this is where the abnormal cells grow in the lining of the cervix uncontrollably and they form a tumor. In 2022, there were approximately 661,000 new cases of cervical cancer, making it the 9th cause of death globally. Now, the interesting part about this cancer is this cancer can be completely prevented. There is a vaccine against this cancer. I know for sure NHS England or in London in the UK, they will have eradicated cervical cancer by in the next 2 decades. Because they are doing a lot of pap smear testing and HPV vaccination to all kids, boys and girls, from the age of 9. So this cancer is formed by, the biggest risk factor is the human papilloma virus, which is called HPV, and we can take a vaccine against it. So this cancer is completely preventable. And we will go into the vaccine of it also later. The signs and symptoms of cervical cancer is bleeding after intercourse or between periods, unusual vaginal discharge, pain during intercourse, and pelvic pain. Any discomfort that is there during sexual activity also can be a simple sign of cervical cancer. Now, very important is that this cancer is completely preventable. So we will talk about the HPV vaccination through this in the next course of this, or I'll actually do it now only. So we have a vaccine called HPV vaccine that can be given to girls from the age of 9 up to 45, which helps to prevent cancer. The earlier in age you give it, the better effect it has. And pap smear is another form of screening or testing that can be done. Advised for all women above the age of 25 to do it, depends once in 5 years or once in 3 years as you grow older. But completely preventable cancer. Even in India, we are talking a lot about cervical cancer now. Vaccines are much more easily available over here. So again, very important from a cervical cancer perspective. Places like the UK are looking at eradicating it. India still stands as one of the countries with one of the highest deaths of cervical cancer. So I think it's just important to weigh that out and see that how we can promote and raise awareness to limit the spread of this cancer. Coming to lung cancer, it is again a very common cancer worldwide, with approximately 2.5 million new cases, and it is also one of the leading causes of death. Lung cancer remains as the most common cancer worldwide, and it accounts for about 13% of all cancers. There are mainly 2 types of lung cancer: non-small cell and small cell. And everybody, I think all of you all will know this, that smoking remains as the primary risk factor, contributing to 85% of cases globally. So it is both smoking with normal smoking, like with a cigarette, etc., or even smokeless tobacco. If you take smokeless tobacco in any form, then that also increases your risk. Signs and symptoms of lung cancer is you have a persistent cough or a cough for a very long period of time that does not go away. If you cough up blood, you're continuously coughing up. You don't have a dry cough, you have a wet cough, so you're coughing up any phlegm or mucus. Wheezing, recurrent bronchitis or pneumonia, pain in the chest or the back of the shoulders. You have changes in your voice, which mainly is hoarseness of your voice. You have shortness of breath. Again, I'm saying having bronchitis or pneumonia, if you have or you've had bronchitis or pneumonia, it does not mean that you have lung cancer, but it could be a symptom. So you need to get yourself checked unless you have another reason for having bronchitis or asthma or pneumonia or anything of that sort. Coming very briefly, I'm going to go very briefly into the treatment and management of these cancers. Cervical cancer is usually the treatment for cancer is chemotherapy, radiation, and surgery. These are the three main pillars of any kind of treatment for any kind of cancer. Usually done in combination of each other, one after the other, depends on a case-to-case basis what might be and how it will be done. So cervical cancer first is surgery where you do a hysterectomy. You have radiation and then you have chemotherapy and targeted therapy. And as I've said, in terms of management, you can do HPV vaccination, you can do regular pap smears, managing side effects of the treatment and fertility prevention. In terms of breast cancer, you have surgery again, which can be lumpectomy or mastectomy, depending on the size of the tumor. Radiation is given, chemotherapy, hormone, and targeted. In terms of management, you should do regular mammogram. So it's usually advised for women above the age of 40 to do a mammogram once a year. If you have a very, very strong family history of breast cancer, like your mother, sister, or your mother's sister, or your grandmother on your maternal side, having history of breast cancer, then I would very strongly advise that you get yourself screened, get a mammogram once a year at least, just from a preventative perspective, because early screening of breast cancer, and if breast cancer is detected early, the management of it is much more simpler, much less aggressive, and much better prognostic ability to it. Lifestyle changes, as I've said, diet, exercise in terms of reducing your risk for breast cancer, managing lymphedema and psychological support. So we'll come to that. Lymphedema is something that happens in breast cancer where your arms get swollen. So you can get physiotherapy, etc. for it. Psychological support and coping with cancer, we'll come through in a minute. Lung cancer, again, the treatment largely remains the same in terms of surgery, chemotherapy, and radiation. Management is mainly smoking cessation, which is very important because that is the biggest risk factor for cancer, lung cancer. You have pulmonary rehabilitation, you have follow-up imaging and symptom management for breathing and fatigue. Prostate cancer is again surgery, radiation, hormone therapy, chemotherapy, etc. But it's very important that men have an active surveillance. So you keep checking after the age of 50 or even after the age of 45 to do a PSA screening once a year or once in 2 years, just to make sure that you are on top of it. So cancer is a disease where if you are 2 steps ahead of it, it will be in your benefit and you can achieve much more from it. PSA monitoring, as I've said, bone health, lifestyle modification, and making sure that you have no other side effects. I can see that a few of you have your hands up, but if you can just wait till we come to the end of the presentation, then I'm more than happy to take all the questions. Just coming to the myths about cancer, I just wanted to cover a few. So the first one they say is cancer contagious. So the answer is no, cancer is not contagious. It doesn't spread from one person to another, though, yeah, some viruses like the HPV or hepatitis B is known to cause some symptoms of cancer, but largely cancer remains as a non-contagious disease. If no one in my family has had cancer, can I get cancer? Yes, you can, because no one in your family who has suffered from cancer does not guarantee that you will not get cancer. As I've said, only 5 to 10% of cancers are hereditary or genetic, and largely 90% of cancer remains as a lifestyle disease. So just because, don't be under that myth that nobody in my family has cancer, so I can't get it. That's not true. Every human body or every human that has got cells that are capable of multiplying is at a risk of cancer. So because it 90% remains as a lifestyle disease, it is very much controllable and modifiable from your risk factors. If I'm diagnosed with cancer, will I die in a short time? Cancer is not a death sentence. Today, we have a lot of advances in cancer detection and treatment, which have increased the survival rates for the most common types of cancers. But what is key and absolutely vital is early diagnosis. So more people are surviving for 5 years or over after a cancer diagnosis, and that purely depends on what stage the disease was caught and how the treatment was given. So it is very important that you stay on top of the disease, do early screening, be vigilant. That is how you can help diagnose cancer early, and you can have a much better life expectancy as well as quality of life. Can herbal treatments cure cancer? Although some studies suggest of alternative or complementary therapies with the help of herbs, etc., they don't really cure cancer. They're not a treatment for cancer, but they may help with the side effects of the treatment, like reduced appetite, nausea, vomiting that you have from chemotherapy, etc. These homeopathy or any herbal medicines, etc., might help you with those side effects, but they are definitely not and proven and as an effective treatment for cancer. So coming to preventive and healthy lifestyle choices, as I've reiterated through my presentation, reducing your risk, one is lifestyle changes. So regular physical activity, having a healthy diet. So when I talk about healthy diet, it has to be low in processed food, high in fruits and vegetables. And when we talk about a healthy diet, it doesn't mean that you have everything on your plate, but it also means that you are well hydrated. Hydration is an important part of a healthy diet, so it's very important to stay hydrated as well. Limiting the use of alcohol, totally avoiding smoking, maintaining a healthy weight. These are your key lifestyle changes that help you with living a much healthier lifestyle, which can help you with the prevention of cancer. Preventive medical measures, as I've said, is regular screening for all those people who are at a high risk or high risk individuals. You can do genetic counseling and testing to know your risk for certain cancers. And some people do preventive surgeries. It's very preemptive. So giving an example, I don't know if you all know about, you all must have all heard about Angelina Jolie. She had both her breasts removed because she had the genetic lineage from her mother, which was a very high risk for breast cancer. So just to give you an example that some people do preventive surgeries, it's not very heard of, but people are choosing to do that. Coming very briefly to coping with cancer, and I'm just going to use coping with cancer and survivorship, giving an example of a patient who had undergone, who I worked very closely with, was a part of my family, had two different cancers, was initially diagnosed with non-Hodgkin's lymphoma in 2005, 2006, had it surgically removed, and then after a few years in 2010 was diagnosed with with ovarian cancer. So she had two different cancers, which is not very commonly heard of. After her ovarian cancer diagnosis in 2010, she went on to have over 50 lines of chemotherapy, multiple surgeries. In At one point in 2016 was advised to have extensive surgery, which included removing a part of her intestine and her spleen and everything, which we thought was not the right thing to do because we thought that she wouldn't cope with it. So we took a second opinion from a doctor in London who said that she was not to undergo the knife, and we continued with normal treatment. She went on to live for 15 years and passed away recently in 2021. But she gave me a lot of lessons on coping with cancer, and I'm going to use her story as a motivation of how we can cope with cancer. So in terms of exercise, it's very important that even during your treatment or you have any treatment, you continue to be physically active as and when possible and as much as you can do, because exercise helps to release good hormones in your body, which will really help you with remaining mentally and physically fit. So this family member of mine used to play badminton as and when she was able to. She used to play. It started declining from what she used to play for an hour and a half before eventually she could play for 15 minutes. But the fact that she could get to a court, she could play, she could meet her friends, she could interact with people was what really helped her. So exercise is very important. You can do any form of exercise. You like yoga, walking, swimming, playing a sport, anything that works, anything that helps you to stay mentally and physically fit is very strongly recommended in terms of coping with cancer. There are definitely lifestyle changes that happen before and after. So if you talk about lifestyle changes that have to happen in terms of preventing cancer, then yes, we should all live a healthier lifestyle with having a balanced weight, balanced diet, maintaining regular exercise. But lifestyle changes happen when somebody has cancer, and coping with that is very important. So giving an example again of this family member of mine in a lifestyle change that probably all cancer patients have gone through is they lose hair, which gives a lot of resistance from an image perspective of how they can cope with it. They might have to wear. So this family member of mine used to wear a wig and used to go out when she was able to go out. But as a family, we supported her. We said, that's fine. The wig looks good on you. Wear it as and when you can. Don't need to wear it in the house. But those are lifestyle changes that one has to adapt to, because you still need to socialize. You can still go out as and when able through your treatment to be able to do that. So these are lifestyle changes, not only from the patient perspective, but also perspective of the close family members. Complementary therapies, as I have said, sorry. Complementary therapies, as I have said, work in terms of the side effects. It could be any complementary therapy, herbal therapy, homeopathy, Ayurvedic, etc. These are not treatment for cancers, but they help largely with the side effects of cancer, like in terms of appetite, nausea, vomiting. Nowadays, hair loss can be prevented by using a cool cap, which my family member also used. So it's like putting a cap and you have cold, icy water running through it, through your head, which prevents hair fall. But even then, there is certain amount of hair fall, but that's a lifestyle change that everybody has to deal with. Nutrition, as I have said, nutrition, I very strongly say hydration along with it. It's very important that you remain and maintain a healthy diet, eat more of grilled and steamed food than fried. Make sure you have fruit and vegetables in your diet. You have a good palate. They say it should be a colorful plate, so that if you have a green vegetable, you have an orange fruit, you have a red salad. So that is also very helpful. Maintaining hydration is very helpful. In whatever form, water, coconut water, whatever works, and whatever your doctor or your dietitian advises you, that also you can do. Eating healthy is what is key. Another very important aspect of coping with cancer is financial wellness. Not many people talk about this, but it's very important, because cancer not only becomes an expensive treatment and a disease to treat, but because the treatment goes on over a long period of time, it can feel the burden on the financial side of things. So make sure that you have financial wellness in the terms of insurance, critical care insurance, or any of the other insurances that you can take. My family member had the insurance, which really supported us as a family during her treatment. And mental well-being. Now, I cannot stress how important mental health well-being is for somebody with cancer. Keeping positive. My family member, whenever she was fit and able and was through her chemotherapy, she's traveled over 13, 14 countries. Like she went to Laos, she wanted to see Scandinavia, so she went to Denmark, Norway, she's been to London. She traveled extensively, Singapore, Malaysia, wherever she could, not very far away or up to Europe. But that helped her with her mental well-being, and being able to do all this and coping and having the survivorship for cancer. She went on to see her 3 grandchildren before she passed away, which very strongly talks about mental health well-being. And mental health well-being is not just important from a patient perspective, but it's also the family members, because everybody deals with this together. So it's very important that we look at it from mental health well-being as a family. So reach out to your friends, your family. Don't be stigmatized with the diagnosis. Let people know that this is what you're going through, because people will help and support you more than enough. So I can't stress how important mental health well-being is to keep a positive attitude towards dealing with cancer. So in terms of survivorship and support, it's the life after diagnosis. I think we've spoken quite extensively about it. In terms of emotional support, counseling, support groups, therapy, as I said, reach out. I'll give you an example. There is a site called inspire.com. It's an American site where people who have cancers, it's like a support network. They talk about the different treatments that they've had, how they've coped, what they did, how they've maintained a healthier lifestyle, how they cope with going out, wearing a wig, etc. You can just reach out. It makes you feel that you're not the only one, and there's an understanding of what people are also going through. Physical recovery, of course, if you've had surgery or any kind of physical therapy that is going on, then you have to abide by those regulations. or restrictions that you might have that help you towards your physical recovery. Very important long-term monitoring. So regular health checkups and scans to be done to keep you monitoring. Your doctor will advise you either once in 3 months, once in 6 months, depending upon your cancer, depending upon the type and the nature of the cancer. And I can't stress enough about support networks in terms of friends, family, cancer organizations. Reach out to people. There is lots of support available over there. Very important, and I like to cover this, is how you can help. I think one very important part is having more webinars and camps or screening camps and spreading awareness, sharing this information with your friends and family and encouraging early screening. Very strongly advocating an annual cancer screening program within every organization. You participate in events like this, joint or host fundraising and awareness events, having screening camps for these cancers, which can be very easily done. Support research. There are organizations that do research for cancer very extensively, and advocate for policy, like encourage policymakers to support access to health access and cancer research, and also for cancer screening, which is very important. In conclusion, I would just like to recap and say the most important things is a lot of cancer is a lifestyle disease. So please be aware of your modifiable risk factors that can help you towards prevention. Early screening is very important because that is what can help to have an early diagnosis and good prognosis and less aggressive treatment. Stay encouraged. I strongly encourage to stay vigilant, take preventing actions, and support those who are impacted by cancer. So together we can make a difference, and every action counts in the fight against cancer. Thank you for listening to me, and I am open to taking questions now. You're
Are you
on
able
mute.
to read the questions, Neha?
I have only
Or
one. I
should I
have
give
one
it
in
to
the
you?
question answer. Dear madam, please explain how blood cancer is different from other cancers. So blood cancer is basically cancer in the blood. It is different from other cancers. As I said, cancer can happen anywhere in any organ. It can happen absolutely anywhere. So blood cancer is a cancer that happens in the blood, where the production of blood cells is altered. So it is different in the sense it's in the blood, but cancer is cancer. It's an abnormal growth of cells. So I hope I've answered your question, Shivam. I can see the questions in the chat actually. I think this one is for you. It says, will we be getting the recording of
Yeah,
this?
yeah, I've told them that they will be getting the recording on YouTube from IMT Care channel. So they
I've got Shekhar Kumar Sinha who said, Madam, can you please go to the previous slide once? I wanted to take a screenshot. I'm not sure what slide you were talking about, Shekhar. If you want to come on the mic and explain yourself.
or you can just type it whichever slide you wanted. Till then, we can move on to the next one.
Sure. I've got Meghna says, hi, I'm 28-year-old female. Can I still get the HPV vaccine? Very good question, Meghna. Thank you for your question. Absolutely, you can. I would very strongly urge you to take it. Giving more details about the HPV vaccine, there are 3 vaccines that are available today. There are 2 important ones called Gardasil 9 and Gardasil 4. And there is one from the Serum Institute of India, which is called Ceravac. All 3 are easily available. You will have to get it through your gynecologist. You can go to your gynecologist who will be able to tell you that. You can definitely take it at your age. I'm not sure your gynecologist will be able to tell you whether you need to take 2 shots or 3 shots of it. So that is what is very important from that perspective. But yes, of course, you can take it. And I would very strongly recommend that you do. And the best person, Meghna, to speak to is your gynecologist. Then I have a question from Rajesh. What about cancer? What are the chances for cancer for passive smokers? Thanks for your question, Rajesh. Very good question. Of course, the risk is less as compared to somebody who's an active smoker. But inhaling smoke is equally bad. So the risk, and as I said, every human being who has cells is capable of multiplying cells at the risk of cancer. So just because you're passive smoker, your risk will be less, but it does not make it zero. I hope I've answered your question, Rajesh. I have the next question by Shakti. I'm age of 28 and physically active. I was once exposed to asbestos dust during a construction work for 10 minutes. Will there be any threat to lung cancer? Thanks for your question. Yes, asbestos exposure remains a risk for lung cancer. But if you've been exposed once for 10 minutes, I wouldn't consider it as a major risk factor. But as described, the signs and symptoms of it, if you feel and if you come across any of that, then please go ahead and get yourself tested. But otherwise, largely, I think it should be fine. And just one-off exposure for 10 minutes shouldn't really increase your risk. I've got Rajesh again. At what minimum age for girls do the vaccine for cancer apply and which one? As I've said, you can start the cancer vaccination from as small as the age of 9 for girls. And you can give any of these three vaccines, Gardasil 9, Gardasil 4, and Ceravac. The younger you are, you need to probably take only 2 doses, which is usually given by your gynecologist, 4 to 6 months apart from each other. Any of these three vaccines can be given. The difference in them is Gardasil 4 works against 4 of the viruses. Gardasil 9 works against 9 of the vaccines, 9 of the viruses, sorry. Uh, People ask me which one you should take. Today there is 9 and 4. Maybe in 10 years or 5 years time, we'll have Gardasil 12. So it's always going to be evoluting. But Gardasil 4 is what has been extensively used abroad and the one that they're using in the UK as well to eradicate it. So yeah, so any of those vaccines you can take. Again, your gynecologist, or in this case, even if it's your young daughter who's small, even a pediatrician can be able to help you with that. I have got Preeti Chaturvedi saying, ma'am, I have seen 2 cases in relatives living absolutely disciplined life with fertilizer-free food and no junk food, etc. Also no hereditary cause. Still they got the cancer and now not with us. This all puts a big question. What could be the reason in these cases of cancer? That's a very good question, Preeti. Thank you. Sorry to hear about your loss. As I said, only 5 to 10% of cancer is hereditary. Largely, 90% of cancer remains as a lifestyle disease. And every human is at a risk of cancer. I also know a lot of people who have never eaten non-veg, never drank, never had alcohol, never smoked, but got bowel cancer at the age of 40. Sometimes there just isn't a reason for this. A lot of cancers may not have a reason, but the fact that they got it, I do understand where you're coming from, but a lot of cancers sometimes don't have a reason that they didn't have any of these risk factors. They could have a genetic risk factor that could have given them the risk. But yeah, it may not have been one of those modifiable risk factors. It could have been one of the non-modifiable risk factors because of which they could have got it. It's very hard to say what would be the reason and what may not be the reason. So from that aspect, it is really hard. But yeah, I'm really sorry to hear about that. Breast cancer slide, if I just go back. This one or this one, I'm going to keep both on for a minute. And yeah. Somebody, I don't have a name, is just giving me a Samsung number. It says how to identify breast cancer. We have gone through it and I've got the slide up now. These are the different symptoms of breast cancer. And if you have any one of these symptoms, then you could be at a risk of breast cancer. So please get yourself tested. If you have to do it from a diagnostic perspective, the gold standard way to identify breast cancer is through a mammography. People do ultrasound also, and if there is a finding on that, they will do a biopsy. Um, but yeah, that is the way to identify breast cancer. I've got Shilpa, who says, you mentioned HPV vaccine can be taken until 45. I'm currently 44. Will it be useful? There is evidence, Shilpa, that says the later in life you take it, it becomes less helpful. But nevertheless, something is better than nothing. It will help you prevent. Whether you need to take 3 doses, which is what I think you would probably have to take at the age of 44. you're at that brink. So speak to your gynecologist and see how you can take that vaccine. But usually it is given up to the age of 45, 46, not after that. So definitely its helpfulness is not as helpful as somebody who's 9 or 12 years old or 25 years old. So yeah, that is, you can check with your gynac, but you can still take it. I've got Fatima who says, what symptoms are there for blood cancer or bone marrow cancer? So all cancers have a different symptom. Breast, usually blood or bone marrow cancer, you will see changes if you take a blood test. You will see changes in that. What I've gone through as the most common symptoms of weight loss, fatigue, etc., will be there. But it's mainly you'll have to do a blood test to see how the cells are not producing or producing within the parameters of a blood test. Shakti, it says, sorry, missed your response due to signal issue. Could you please repeat? I am just let me finish with the symptoms of blood cancer. It's usually fatigue and weakness, frequent infections due to the weakened immune system. That is another symptom of it. Symptoms of blood cancer. Shakti, I don't remember what was your question. I'm just going to go back and check. Yeah, you was with regards to the asbestos, one exposure for 10 minutes does not put you at a very high risk. But again, the symptoms that I've gone through, be mindful of that. If you have any of that, then please go and get yourself alerted and checked. I've got Aarti Sharma says, if I have a family history of prostate, breast, and pancreatic cancer, so when can I start the screening test, or should I wait for the symptoms to appear? A very good question, Aarti. Thank you. Of course, you shouldn't wait for any symptoms to appear. Please start screening. Depends on your age. Prostate cancer for the men in your family should be checked from the age of 45, 50 years old. They should do a PSA to get themselves screened. Breast cancer, definitely from the age of 40, you can get a mammography done every year. Breast, it's very important. There is, if you Google self breast screening, it's called breast self examination. That can do, you can assess your breast by yourself. Very strongly advised to be done every month. Just using your hand in a sitting and a lying position. Usually recommended 2 weeks after your periods are due or periods are done. So definitely, please don't wait for symptoms. Start screening as early as possible. Prostate, definitely from the age of around 45, we say 40, 45 to do a regular PSA screening. Pancreatic is a slightly difficult one to screen, but again, if there's a strong history of pancreatic cancer, you can speak to your doctor and get scans done, which will help with the screening for pancreatic cancer. I've got Farheen. If there's no genetic predisposition, should one be worried about any type of cancer? As I've reiterated, that 90% of cancers are not genetic, they are a lifestyle disease. And anybody can be worried about cancer, absolutely. So if you are, I'm just going to put this hypothetically, if you're morbidly obese, you drink a lot, you smoke a lot, you have a very bad lifestyle, then yeah, sure, you might be at the risk of cancer and it might not help. So yes, because it's largely a lifestyle disease, I would definitely think that you should be mindful of it. Vasu, good evening. I heard in the news that Tata Institute has developed a pill to avoid cancer. Is it in the market and when it would be? Can you give more details on this? Thank you. Thank you for your question, Vasu. It's a very generic question. I am not aware of any pill that has been developed to avoid cancer. So I don't know what you are referring to. If you know a name, if you know something, please share it, that we would be more than happy to learn more about. But as far as I know, there is no pill that can avoid cancer. The only one vaccine which is there, and there are a few vaccines. So the HPV vaccine helps against cervical cancer, which I'm very well aware of. Are there vaccines available for other type of cancers has been asked by Charvi. Predominantly, it is this cervical cancer vaccine. More and more research is happening. So in the future, definitely more and more cancers will be able to come out with it. Going back to the question on the pill, there is no pill, as far as I'm aware, that can give a guarantee that you're never going to get cancer. So yeah. I have Samsung, somebody again. What test or blood test for breast cancer? Breast cancer, there usually isn't a blood test. It's usually a mammography or sonography of the breast that helps with the diagnosis of breast cancer. I have got Girish Kumar. Hi. Hi, Neha. My grandfather got affected with prostate cancer at the age of 55. Now I'm 28 years old. Will there be any chances of me getting affected? And will there be any test to identify early stages? Thank you for your question. As I have said that you should get yourself screened from the age of 40 or 45, get a PSA done, which is called prostate specific antigen. It's a blood test which helps to screen you for prostate cancer. It is prostate cancer remains slightly familial. There is some genetic, but it's not completely a genetic cancer. So I would say be mindful, be on top of it, stay healthy, live a healthy lifestyle. And we've gone through the symptoms of prostate cancer. So if you feel like you have any, then go and speak to a urologist or to your doctor, who can help you with that. Um, so yeah, I think you're at a good age and you still have time before you can get yourself screening. I've got one more question here. It says, Madam, may I know the cause of getting lung cancers? I know most people who don't have smoking, but they have still got lung cancer. I agree with it's an anonymous attendee. So thank you for your question. I agree with what you have to say. These are just risk factors. Some people may have the non-modifiable risk factors, genetic predispositions to cancers. I also know a lot of people who don't smoke but have got there is one bits of research that said it could be the pollution that we all breathe in. There is no definitive finding or research evidence to support that. But definitely, one of the causes, like smoking remains, is caused by genetic mutations in the lung cells, though smoking remains as the largest risk, modifiable risk factor. But people have non-modifiable risk factors as well, like genetic predisposition, because of which they may get the cancer. So it's important to be mindful of it from all aspects. I think I've covered all the questions. I can't see any more. But anybody else got any other questions?
Have we taken the Shivam Sharma's question? If person not consume tobacco,
Oh, no,
alcohol,
sorry. I've got that. I've got that.
that's the last one, I guess.
Yes. So if person did not consume tobacco, alcohol, and eat healthy diet, but still mouth ulcers coming back and again is an early symptom of mouth cancer. Hi, Shivam. Thanks for your question. If you have repeated mouth ulcers or patches within your mouth, you should go to a dentist and get it screened. These are some of the early warning signs of oral cancer. But as I've said again, just because you have ulcers, that does not mean you'll have oral cancer. But it's important to get yourself checked because you have these symptoms. Go to a dentist who will be able to screen your oral cavity. If the need be, do a biopsy for any white or red patches or these ulcers that you have. If they might not be anything, they might suggest something else around it. But if you're getting repeated mouth ulcers, then definitely it can, because mouth ulcers can occur in somebody who doesn't have alcohol and tobacco also. But the fact that you're getting them, I would suggest that you go to a dentist and get it screened. Yeah, I think I've covered all the questions now. Anybody else got any other questions? Thank you, Shakti, as well. I can't see any more questions, Anamika.
Yeah, sure. Uh, guys, if anyone have any questions, this is the time to ask. And if not, we can thank Dr. Neha for this insightful session. And
Thank
obviously, I mean, more and more awareness is required. So if you can, if all of you who have attended, if you can aware yourself and the people around you, it will be very beneficial for all of us. Because so that we can prevent this big, disease at the earliest and not lose our people around, right? So
I've got somebody called Sujoti who's raised her
okay.
hand. I'll just take the question.
There is one Girish Kumar question also. You can just take, yeah, we still have 10 minutes.
Yeah, sure. So I've got a Shankar's question. It says, is microwave usage related to cancer? there is no evidence to support that if you heat your food or cook your food in a microwave, it supports it is a risk for cancer. There's no evidence to suggest likewise or otherwise. I've got Girish Kumar. Hi, Neha. My wife got affected with lymph node enlargement in neck area. Will this be a cause? It's very unlikely to say what the cause is, but the fact that she has a lymph node enlargement, please get it checked. Please go to a doctor and get it checked for why is there a lymph node enlargement in the lymph in the neck area. It could be something, it may not be something, but always remember, as I've said through my presentation, just because you have a symptom, that doesn't mean it's cancer, but it's very important you get it checked. Don't ignore it. And just as you have said, Girish Kumar, for your wife, please don't ignore it. Get it checked. They will be able to tell you if they need to do any further tests or anything of that sort, because any symptom does not largely mean that it is definitely a cancer, though it is a symptom for cancer. So definitely don't ignore anything and get yourself checked. I've got Pranjali. Ma'am, can air fryer be a reason for cancer? As I said, just like the microwave, there is no evidence. An air fryer is all the more a healthier way of eating food, which we like is usually fried, but in an air fryer, it is not fried. So, in a way, it is a healthier option than fried food. But just like the microwave, there is no evidence to suggest that air fryer food can be a cause for cancer. I have Nilambika. Just a heads up, is a hair loss a symptom of any cancer? There could be multiple reasons for hair loss in terms of hormonal changes, in terms of just hair quality changes. It could happen during your hair goes through a cycle, so the hair cycle may be falling. If you have your periods coming, you might have it. So there could be multiple reasons for hair loss, not necessarily just as a symptom of cancer. But yeah, alopecia or hair loss can have multiple reasons. It is not commonly known as a common symptom for cancer, but of course, if you have excessive hair loss, then I would get it checked. You could have a hormonal deficiency or just a vitamin deficiency. But as I said, if you have a lot of hair loss, I wouldn't take it lightly. I would get it checked in case it's a symptom of anything underlying. I've got Manoj. What care needs to be taken by someone who has colonic polyps, low grade dysphagia removed? So if you have had colon polyps in the past, they remain as a risk for cancer for sure. But that doesn't mean that you definitely have cancer. It might just increase your risk. So I think you will be given information about your diet and what you need to do. So from that aspect, it is to be preventive from that phases. I don't know, you might be advised regular colonoscopy so that you can do just to make sure that you're on top of the disease. Um, and if you've had it taken out, then of course your doctor has advised you on what has to be done about it. Uh, so in terms of the colon polyps, it's again a healthy lifestyle, maintaining a healthy weight, etc., is what will be helpful from the modifiable risk factors. And so I've got an anonymous person who said, sorry, I missed the initial 10 minutes of your session. Are there any specific symptoms that we need to keep in watch? I went through some very general symptoms of cancer. I'm just going to put that up for you. These are the risk factors, which are modifiable and non-modifiable, as you must have heard me say to the rest of the presentation. And these are some very, very general symptoms of cancer. Yeah, I think, Anamika, I've covered almost all the questions. No, I've got one more. From Girish Kumar, multiple lymph nodes in the neck enlargement. And when we consult doctor, he suggested an FNAC. Yeah. Uh, I'm sorry, Girish, I cannot take personal questions on this in terms of, what will be the treatment for necrotizing lymphadenitis. I think it's best you consult your doctor and see what they have to say. This won't be the right platform for me to go into the details of the personal, because I will need a lot of history also about the FNAC, what was done and stuff like that. So I don't think this is the right place. You can write to me at hello@oncoconnect.com. It is there at the end, and I'll be more than happy to connect with you. That's our email address there, hello@oncoconnect.com. And if you just tell me that you wanted to speak to me from the IMT Care presentation, then I'll be more than happy to connect with you.
Okay, I believe no other questions are there, and all the questions were, gracefully answered. So thank you so much, Neha. Yes, thank you so much from
Most
everyone
welcome.
here. And we had a very insightful session. We got so much of knowledge. We broke so many of myths. So I hope everyone got those insights and it helped us and all of the people present here to a great extent. Uh, yes, so if anyone wants to talk to her, you can just email her on oncoconnect.com or the hello@oncoconnect.com. So you can copy these email IDs and connect with her. So yeah, we'll end this session here on a great note. Please do the prevention test and stay safe and stay healthy, everyone.
Thank you so much for having me. It was my pleasure to speak to you all.
Yeah, thank you so much.
Thanks.
Thank you, everyone, for joining. Bye bye.
Bye. Bye-bye.